Seniors, have you ever wondered what could happen if you started taking magnesium glycinate every night for 30 days? Many people say the changes they feel, sometimes by week one, are almost hard to believe. Magnesium isn't a stimulant or a quick fix. It's a mineral your body quietly relies on for thousands of daily functions. But as we get older, magnesium levels naturally decline. That's when muscles tighten, nerves become more sensitive, sleep gets lighter, and energy becomes harder to maintain. And here's something many seniors don't realize. Large nutrition surveys in the United States show that a significant number of people aren't getting enough magnesium from their diet. So symptoms like cramps, fatigue, stiffness, anxiety, and brain fog aren't always just aging. Sometimes the body is simply running low on a mineral it needs. Quick disclaimer. This video is for educational purposes only and isn't a substitute for medical advice. Always talk to your doctor before changing your supplement routine. In this video, we're breaking down the 5 biggest changes you may notice within 30 days of taking magnesium glycinate. And number 2 is something many people thought they had lost with age. Before we dive in, let me know in the comments. How old are you and where are you watching from? We're responding in a friendly, real conversation style. Now let's start with change number 5. The first improvement most seniors notice. Change number 5. Your muscles transform from tense to truly relaxed. Many people notice their muscles don't relax as easily as they used to. Maybe it's that eye twitch that shows up out of nowhere, leg cramps that wake you at night, or shoulders that stay tight no matter how much you stretch. These issues can happen for reasons beyond age alone, and low magnesium levels often play a major role. Around week 2 of consistent magnesium glycinate supplementation, noticeable changes can start to happen in your muscles. Magnesium acts as nature's calcium channel blocker, helping muscles relax after they contract. When a muscle tightens, calcium moves into the muscle cells to trigger the contraction. Magnesium then helps move that calcium back out, allowing the muscle to release. Without enough magnesium, some calcium can linger, leaving muscles partially contracted and causing tightness, cramps, and twitches. Here's where it gets interesting. A randomized trial from Baylor College of Medicine on adults with chronic muscle cramps, including many seniors, found that taking magnesium daily for 4 weeks significantly reduced how often cramps occurred, shortened how long each cramp lasted, and even improved sleep quality compared to placebo. This kind of relief helping muscles relax and reducing tension that often increases with age is what many people report noticing around week 2 with magnesium glycinate, a form that's especially easy for the body to absorb. Magnesium glycinate also works through a double mechanism. Magnesium helps muscle fibers unwind after contraction. Glycine supports calming signals in the brainstem and spinal cord, helping muscles let go more fully. During your 30-day journey, you may notice fewer random twitches, nighttime cramps becoming less frequent and less intense, persistent tightness in the neck, shoulders, or lower back starting to ease, often more effectively than stretching alone. Many seniors find that taking magnesium glycinate in the evening fits naturally into the body's wind-down cycle. If you stay active or exercise, taking it afterward can help your muscles transition smoothly back to relaxation. Individual responses can vary. By day 30, many people report easier movement, less tension, and fewer interruptions from muscle cramps, helping you feel more comfortable as you move, rest, and recover. Change number 4. Blood sugar support may improve. As we age, our cells may not handle sugar as efficiently as they used to, and magnesium plays a key role in supporting healthy blood sugar levels. When magnesium is low, cells respond less effectively to insulin, leaving sugar lingering in the bloodstream. This can increase cravings, cause energy crashes, and over time, raise the risk of metabolic issues. Taking magnesium glycinate consistently for 30 days can help support this balance. Magnesium is involved in hundreds of processes throughout the body, many of which affect how cells use glucose for energy. In simple terms, it helps your body manage sugar more smoothly, which can lead to steadier energy during the day, something many older adults notice almost immediately. A long-term U.S. study conducted by several major universities tracked more than 2,500 middle-aged adults over 7 years. Those with the highest magnesium intake had a 37% lower risk of developing blood sugar problems. Even people who were already at risk saw slower progression toward diabetes, While this study focused on middle-aged adults, the same benefits apply to seniors, who often experience more frequent blood sugar swings. Another study at the University of Southern California followed people taking magnesium daily for 4 weeks. The results showed that magnesium helped the body use insulin more efficiently, allowing sugar to be converted into energy instead of staying in the bloodstream. This helps explain why many older adults report steadier energy, fewer sugar spikes, and reduced cravings when their magnesium intake is consistent. Change number 3. Your blood pressure begins responding to nature's relaxation mineral. As we age, changes in blood pressure can happen for reasons beyond genetics, stress, or lack of exercise, and one of the most overlooked factors is low magnesium. Magnesium plays a major role in helping the smooth muscles in your blood vessels relax. When magnesium levels are steady, your vessels stay more flexible, circulation feels smoother, and your body doesn't have to push against unnecessary tension. But when magnesium drops, something that can happen easily with a poor diet, too much caffeine, alcohol, or chronic stress, your vessels can tighten more quickly, forcing your system to work harder just to maintain balance. A large meta-analysis published in the American Journal of Clinical Nutrition reviewed multiple clinical trials and found that magnesium intake was consistently linked to small but meaningful improvements in blood pressure readings. Another study in the Journal of Hypertension noted that forms like magnesium glycinate tend to be well absorbed, which is why they're commonly mentioned in discussions about cardiovascular support. Here's the simple version. Your blood vessels contain smooth muscle, and magnesium helps those muscles relax. When your magnesium levels are supported, many older adults notice they feel calmer, steadier, and less tense, making it easier to maintain a healthy vascular rhythm. Pairing magnesium with potassium-rich foods can support this balance even further, because these two minerals work together inside the body. Foods like bananas, leafy greens, sweet potatoes, nuts, and seeds provide both minerals in a way that supports your heart and circulation, especially helpful for seniors who want to support healthy blood pressure naturally. With your blood vessels finally finding their rhythm, your body is now ready for the next transformative change. Change number 2. Sleep transformation. Sleep like a baby. Seniors. One of the most noticeable changes you may experience after taking magnesium glycinate consistently for 30 days is deeper, more restorative sleep, the kind where you actually wake up feeling refreshed. Magnesium plays a key role in regulating your nervous system, relaxing your muscles, and balancing the neurotransmitters that help your brain shift from wakefulness to sleep. In particular, magnesium supports GABA, the brain's main calming neurotransmitter. Think of GABA as your body's natural off switch. When magnesium is low, your brain can't settle down properly at night, leading to racing thoughts and restless sleep. Magnesium glycinate helps restore these levels, improving GABA activity and allowing your mind and body to relax naturally. Several U.S. studies confirm this effect. For example, a clinical trial published in the Journal of Research in Medical Sciences followed older adults with insomnia. After 8 weeks of daily magnesium, participants fell asleep faster, stayed asleep longer, had higher melatonin levels, the hormone that regulates sleep, and showed lower cortisol, the body's main stress hormone. What makes magnesium glycinate unique is the glycine component. Glycine helps soothe the brain, lower core body temperature, and calm the nervous system before sleep. When paired with magnesium, it creates a powerful synergy. Magnesium absorbs better, relaxation deepens, and falling asleep becomes easier. Plus, magnesium glycinate is gentle on the stomach, so your body can use it efficiently without digestive discomfort. During your 30-day journey, sleep improvements often follow a predictable pattern for seniors. Week 1. Falling asleep becomes easier, and racing thoughts begin to quiet down. Week 2. Nighttime awakenings decrease, and many seniors start sleeping through the night more consistently. Weeks 3 to 4. You wake up feeling more refreshed, with better energy and clearer mental focus than you've had in years. Over time, your sleep architecture improves, meaning you spend more time in deep and REM sleep, the stages most important for physical recovery, memory, and overall brain health. By the end of the month, your body settles into a healthier, more balanced sleep-wake rhythm, guided by melatonin and cortisol. The result is restorative sleep many older adults thought they had lost. Change number 1. Your stress and anxiety levels may improve. One of the most noticeable changes you might experience after taking magnesium glycinate consistently for 30 days is a greater sense of calm. This might feel like your body and mind are working more in harmony. Magnesium is thought to play a role in regulating the stress response system, which can influence mood and emotional balance. Magnesium is often described as a natural relaxant for your nervous system, and it may help support the regulation of the hypothalamic pituitary adrenal HPA axis, the central stress response system in your body. An overactive HPA axis can keep cortisol levels high, contributing to stress, anxiety, and even muscle tension. Magnesium may help regulate this system, signaling to your body that it's okay to relax. Magnesium is also thought to influence neurotransmitters like GABA, which helps calm overactive neural activity, and it may reduce nerve excitability by blocking the NMDA receptor. The glycine portion of magnesium glycinate is another factor, as glycine itself is a calming neurotransmitter that helps soothe the brain and spinal cord. A 2017 study conducted by researchers at the University of Vermont found that magnesium supplementation led to noticeable improvements in both depression and anxiety within just 2 weeks, thanks to its effects on the HPA axis and GABA, which help the body relax. Another study in the U.S. trial with older adults with type 2 diabetes showed that daily supplementation improved mood and reduced anxiety symptoms, demonstrating benefits even in more vulnerable populations. Many older adults report feeling calmer and more balanced when magnesium intake is consistent. Some people feel benefits within 2 weeks, while others need the full 30 days. So be patient with your body. Magnesium glycinate simply gives your body what it needs to work the way it was designed to, especially in a world where modern diets often fall short, which can affect many older adults. Whether you're a senior looking for better sleep, calmer nerves, less tension, or overall health support, this form of magnesium is gentle, well-absorbed, and widely used. Just remember to talk with your healthcare provider before starting any new supplement. If you're concerned about leg strength as you get older, I recommend watching the next video. It walks through 3 bedtime vitamins in a simple, safe way. Take care, and if you want more tips like this, subscribe. I'll see you in the next one.